Hi, welcome to the first newsletter about dry eyes. So myself and Fiona, for the last 18 months to 2 years, have been embarking on our dry eye clinic, and we do have a few patients, some of which will have seen us during the dry eye clinic. And we just want to raise awareness that dry eye can affect us in so many different ways. About a third of us will suffer from chronic dry eye, and there are many facets as to how to manage the condition. Dry eye disease is a chronic condition, so it's not necessarily about curing it, but it's about managing the symptoms. And symptoms can certainly vary significantly between one person and the next. There can be underlying conditions that can start or exacerbate or trigger the eye issues, and it's such a multifactorial condition. So in a dry eye consultation, what we will do is, using diagnostics that we have in the practice, assess the surface of the eye, discuss your symptoms and any underlying health conditions that could also be likely to contribute, and then based on what we find and what we see, we're able to then give a tailored solution to best manage those symptoms for a long-term sort of health best optimization. Because if you have a condition that you wait until it's got really bad and you then reactively start to treat, we're almost catching up, whereas if we identify problems early, we can much better manage the prognosis and how much you suffer with it compared to responding to it more reactively. To start with, I think I'll talk about blepharitis and inflammation. So many of you may have heard of blepharitis, but if you're not, it's extremely common. Blepharitis it arises with debris around the eyelids and the lashes, which we can see using the technology and the equipment that we have in the practice, and it does need to be managed. So we have a tiny microbe, everybody does, across the skin around the face, and if that little tiny microbe goes a little bit out of control, it can actually cause trouble around the eyelids and lash area. If that microbe gets into the lash follicle, which often it does if we can see evidence of it, it can damage that follicle, it can damage it long term, and it can actually cause gland dropout. So in the eyelids, if we look at this cross section, we have the eyelids and the lashes, and then if we take it on its side, these are the meibomian glands. Out of these glands, we have a special oil, meibum, which is produced. A bit like in the skin, you have sebum, which is produced, and this is called something else. So it's really an important part of the tear film. And if our glands drop out or become damaged for various reasons, and again, that's something that we try to uncover, then we are going to reduce one special and very important part of the tear film, because the oil that comes out of here actually forms the top surface, a little bit like a sort of seal of oil, to reduce the water that's underneath it from evaporating, and that's the protective barrier of the tear film. So many things can cause this imbalance, but one of them, for example, could be to do with meibomian gland dysfunction, and this is one of the things that we absolutely look for. So that's just one of the things that we talk about when it comes to dry eye, and I don't want to overload you. So next time we will talk maybe about nutrition, treatments, and what's available over the counter to help with management of the symptoms.